Hello, and welcome back to the Agape Project. I'm author and minister Cynthia Middlebrooks Harris, and we developed this project a few weeks ago to have a forum for people who are taking care of elderly, handicapped, dementia, Alzheimer's, or brain tumor, stroke, any of those kind of issues, taking care of their loved ones. A page where we can get together and lean on each other and discuss ins and out, give techniques, give tips, talk about things that's worked for them, learn information about how to take care of your loved one, and also, get prayer. Add your loved ones to the prayer list. So we want to talk this week about nutrition. Again, you will see me look away from the camera as I begin to read some of the notes that I've gotten. We're going to talk about different foods you may want to avoid, different foods that may actually help with dementia, and things just about the nutritional health. It's going to be really brief. I'm not an expert. I'm not a professional. I'm just someone that is taking care of my mother, and I just really, really care about. I have a passion for that now, and it's a ministry for that now, and I just want to help someone else who may be in the same situation dealing with it. Now, first of all, next week we're going to start talking about the caregiver, the care provider, dealing with our fears, taking care of ourselves, dealing with our emotions and our and what we're going through, and taking care of them. The legal things, we're going to get into more of the hospice care and taking care of that, later on in some of the other weeks. But this week we're going to mostly talk about the nutrition of the one specifically with dementia. And my mother's dementia, again, is caused by a brain tumor. And Alzheimer's and dementia are very, very similar to the same thing. But there's some different things. First of all, people with dementia need help with food choices. Often the act and eating itself, as time goes by, some days my mother understands the concept of how to use the spoon. Other days she doesn't. She may eat the sloppiest of foods with her fingers because she just cannot grasp the concept of how to make the spoon work. And then those times I just let her do it. I don't make a fuss about it. I don't say, "Oh, mom, eat with the spoon." I just simply let her eat the way she wants to eat. So the first thing that I want to get into this really quickly before I go into the rest of nutrition is, if you're the caregiver, you have to really quickly get over how you feel about your loved one in public, because they're not going to always act the way you want them to act. So you have to really, really quickly make a decision. I'm not going to worry what people think about my loved one, what they're saying, what they're doing, how they're eating, how they're reacting, because I'm not here to try and make your world pleasant for her. I'm here to try to make this world pleasant. Your world pleasant. I'm not here to try to make your world pleasant for you. I'm here to make the world pleasant for her. So I don't care if she doesn't do the right things in front of people. That doesn't bother me. So we'll talk about that a little bit more next week in the caregiver. So quickly get over that fact. You may have to help them eat. You may have to, choose finger foods. Choose things that are going to be easy for them to navigate. There are certain things that I just don't feed my mother anymore, even though they're nutritional for her. I just really don't feed them anymore to her because it's just difficult for her to navigate how to eat it. And a lot of people say, "Oh, you're babying her, you're doing too much for her." No, I've read and I understand what I need to do. I chop her meat up in small proportions so she can pick it up with her fingers and she can eat it. I don't give her vegetables that have a lot of stringy shreds to them because I don't want her to choke. Even though asparagus is very good for people with dementia, you have to be careful with asparagus because it has very stringy parts to it, and it's kind of a little bit hard for them to chew, and especially if they're like my mother, and they have had all their teeth removed, so because that was part of what her problem was, a viral infection through her gums. So I don't feed her things that are going to be hard for her to navigate and to chew and to eat. Dementia most often affects older people, and older people have problems with constipation, making consumption of dairy fiber important. It's going to be very important for you to slowly increase their fiber take. I usually give my mom, she usually eats at least 1 to 2 bananas a day. She has yogurt for breakfast every morning. I give her applesauce as snacks throughout the day. Different things is going to help keep her bowel moving, because they get constipated. They don't always understand how to push and to push things out. So it's going to be very important that nutritionally you feed them foods that are going to be easy to digest. And I know sometimes they may want certain things, and sometimes I give her certain things that she likes just because she likes them. I give them to her, but I try to limit the intake on it. And sugar is one of those things you're going to want to limit the intake on, is a lot of sugar. Good sources of fiber are whole grain breads, cereals, beans, fruits, and vegetables. Now, my mom is not really big on vegetables, so sometimes I have to camouflage them and make them a little sweet, but I try to use natural honeys and things like that instead of just really raw sugar. The recommended fiber intake for adults is 25 grams a day for women, 38 grams a day for men, ages up to 50. Now, women over 50 should have 21 grams per day, while over 50 should have 30 grams per day. So I said that backwards. I meant that fiber has to increase. I've said fiber has to increase. I meant fiber has to decrease because fiber is bulk and it will make you constipated. So you have to limit some of it. And give them more fruits, more vegetables, more things that are gonna make them keep their bowels moving. Instead I found that my mother does best, and most people, this just should just be a rule of thumb for everyone. Most people do better when you eat smaller and frequent meals throughout the day versus sitting down to three large meals a day. Because of their concentration problems, they may get more appetite. Their appetite may changes, how food tastes to them changes. People with dementia can sometimes not eat a full meal in a full sitting because their attention span won't hold their attention span long enough to actually finish. So I found that if I feed my mom smaller meals every 2 to 3 hours, she actually does better, and her digestion is actually better. And I give her water and juices, warm apple juice or warm prune juice in between to kind of keep it, because my mother does have a slight problem with constipation sometimes. So I do those things to keep her moving fluently and frequently, because I think a lot of times she's trying to hold it in because she's thinking that I should not, soil myself. So she'll hold it in. If she can't quite tell me I've got to get to the bathroom and we can't get there in time, she'll just keep holding it. And before you know it, she's held it all day or into the next day, and then constipation becomes a problem. So frequently putting them on the bathroom, even if you think they have to use the bathroom or not, if you're going to be the caregiver, you're going to have to put forth the time that it takes to take care of them. So you can't be like, oh God, it's 20 minutes. It's a 20-minute process to take her to the bathroom. Well, that's part of what your job is to be the caregiver. So I take my mom to the bathroom quite often. So that way she's sitting on the toilet quite often, because it's just like a baby. They go back to not, it's like potty training. They go back to not really being able to really always tell you what's going on or what they need to do. Amen. You want to really try to kind of stay away from a lot of gravies, even though this good. A lot of older people produce less saliva, according to the University of Maryland Medical Center. Dry mouth interferes with chewing and swallowing, so they suggest adding gravies and sauces, which is good. But you want to be careful when you're making the gravy, not to add too much salt to it. Try to use a little bit more natural herbs and spices versus just using a lot of salt, because then if you have a really salty gravy, now you get into another issue, especially if your loved one is on high blood pressure medication, which my mother is. So I really kind of limit how much salt I use, and their taste buds usually go very quickly, so you're more apt to add more flavoring to their food. But try to use natural flavoring techniques, natural herbs and spices, versus just beginning to dump a lot of salt in it, because you don't want to create another issue in their life. If their blood pressure is high, you don't want to create that by adding so much salt to their food, because their taste buds do diminish with dementia. That is one of the side effects of it. Food just will not taste the same to them. So you have to be very careful. Also, people with dementia sometimes have difficulty swallowing. It's a condition known as dysphagia. That dysphagia is dangerous because it can lead to choking and food or liquid being aspirated in the lungs. If a person has this disease, avoid giving them hard to chew foods such as raw vegetables. I never give my mother broccoli. I avoid corn. Things that are very hard to chew and hard for her to chew. I feed her, she mostly eats as vegetables. She loves green beans, so I give her green beans. She eats mashed potatoes. I cook the carrots a little bit softer. When I cook them, squash, I make sure that I peel it, and I only give her the inside portion of the squash. I chop her meats up, and I kind of overcook them a little bit to make them softer, so she can chew them better, so she can enjoy it, so she won't choke. Sometimes you may have to thicken their liquids in their beverages sometimes, so they won't go into the lungs. My mom doesn't have a problem with her food, but sometimes she has a problem with her beverages. So now I juice most of her juices now. And when you juice the juice, like if I juice apples, it's different from the apple juice in the store. It will actually be an apple cider, which will be thicker, and it's easier for her to swallow because it's not so liquidy. So you may have to change and begin to juice the things for your loved one, and versus the juice in the store, which is going to be better for them anyway, because now you're not giving them all the preservatives, you're giving them just the fruit. And my mom loves the apple juice that I juice for her, and I give it to her every morning. You have to be careful with it because it will sometimes cause diarrhea. You just have to kind of thicken up their juices. Uh, some of the things that you might want to give them to eat, you could consider them eating more often, are homemade yogurts, um, defatted soy flour, uh, uh, oatmeal. My mom usually has oatmeal in the morning. Whole grain cereals and breads, but limit the intake on those because you don't. There again, you don't want to get them constipated. Sugar-free and fat foods. Low-fat tomato sauces and pasta. So whenever I do spaghetti, whatever, I try to make it like a low-fat pasta. Olive oil, which is what I cook in anyway. Olive oil and canola oil, substitutes for other oils, but use them sparingly because you don't want to. There again, you don't want to clog them up too much. Salmon and fish are really, really good for people with dementia. It's really good omega because it's good omega 3, and that's also good for your brain and your thinking. Um, for fish, I mean, 1 to 5 servings of fish is research is recommended a week. And I, since I'm a vegetarian and all I eat is seafood, that is very easy for me to easy regimen for me to follow with my mother. Green leafy vegetables are a must, and a lot of times my mother won't eat a lot of green vegetables, so I make smoothies, and I'm a smoothie queen anyway. And I put spinach in the smoothie now, and now I put apples and strawberries and bananas in there, and she'll eat it as a treat. But now she's got her spinach, so you have to do things to make it. You have to work around because they're gonna change every day what they do. Every day is like waking up almost to a different person. So you have to roll with what they're feeling that day. Carrots lightly cooked, pumpkin canned or cooked, squash, fresh fruit, dried unsweetened fruits. But see, that's not good. That with my mother, that's not good because she has a problem with the chewing. So I don't give her dried fruits at all. I don't give her nuts and stuff because she doesn't have teeth. But if your loved one has them, then feel free to go for the nuts and the fruit. Grapes, especially red grapes or black, any kind of red or black fruits or vegetables are very good for dementia because they're very good for your brain and very good for thinking. You want to avoid whole milk products. With people with dementia, you want to avoid red meats if at all possible. You want to avoid hydrogenated oils such as stick margarine, uh, um, foods that are high in fat and high in butter fat and high in animal fats. You want to avoid hot dogs, hamburgers. You want to avoid salt. You want to avoid sugar, chocolate, unless it's like dark chocolate. And my mother loves Hershey's Kisses, so I will still give her Hershey's Kisses and give it to her. But I kind of avoid. I don't give them to her all the time, but I try to use dark chocolate whenever possible. You want to avoid soft drinks and avoid, of course, alcohol. It says over 1 to 2 ounces a day, but we don't drink. We're Christians in this home, so we don't drink anyway. So those are the things you want to try to avoid, and some things that are kind of helpful with foods. Now, this is not everything. This is just a small thing to get you started. You can always just Google foods for dementia patients, and you'll be surprised. A whole list of things will come up, do's and don'ts. So get out there on the web page and explore so you can help take care of your loved one. You don't want to be a hindrance to them. You want to be a help. So if there's things they should avoid, find substitutes where you can still give them something that they want to enjoy. There's so many things that you can enjoy, and everyone is different. What works for my mother may not work for yours. So explore different things and see what works. But keep tuning in because next week we're going to get into taking care of the caregiver, and how we ought to take care of ourselves and some things that we may feel and overcoming some of those things. I just pray that God will continue to bless you and to take care of your loved one. And I thank you that you have compassion, that you are a part of the Agape Project. God bless you, and we'll see you next week.